All right, good evening, everybody. Thank you for joining us for the Rules and Legislative Oversight Committee. I would like to recognize the Health Commissioner for joining us. Thank you, Madam Health Commissioner. And then my colleagues, we have, I'm just going to go in the order that I see you, Councilwoman Ramos.
Thank you, Mr. Chair.
Councilman Glover, Councilman Costello, Councilman Torrance, Councilman Conway, Councilman Stokes. All right. And so being that this is a virtual hearing, and keeping with tradition for all the other hearings, if you are one of the panelists, we would ask you to keep your cameras on for efforts of transparency for those who are watching on TV or on their computers. This hearing is on the vaccine rollout oversight and to discuss the canceled COVID vaccine appointments. The other week, the Health Committee heard from the Health Department and local partners on the latest of where we are with the COVID-19 pandemic and the information on the safety of the vaccines, and we appreciate their time on that. And today, we will just be getting into the weeds on the local rollout, the canceled appointments, with the hopes that the issues of the past can be resolved and not repeated. I want to start off and thank Mayor Scott and Council President Mosby for their leadership in pushing for accessible and equitable testing and vaccinations, especially in moving the vaccine site from Port Covington to BCCC. Additionally, the latest request from Mayor Scott to purchase vaccines directly is certainly the level of urgency that we need to lead us out of this pandemic. So on to this hearing. I will give my introduction and then we will move on into questions and a presentation if the Health Department would like to proceed on a presentation. But I must say that I've lost sleep over this botched rollout. I am sick to my stomach that I am part of a government entity that has treated human life in the way as I witnessed last week. It is not how I was raised, and it was not what I believe in. I believe that one who saves a life, it's as if they saved an entire world. Every day, I can't help but stress the possibility that some one of those 500 people that have had their appointments canceled will contract COVID and die prior to their opportunity to get a new vaccine. I won't live in regret knowing that I didn't do everything I could to save those lives. I want to give you a few examples of those whose appointments have been canceled last week. A couple both in their 70s. The husband has a heart condition that requires a pacemaker. The wife has a bone infection in her skull. The couple drove anxiously to BCCC last Tuesday and was met as, the way they put it, a bunch of Army men who said this location is only for second dose. They hadn't seen any notification to the contrary or notification that their appointment had been canceled. A cancer survivor who needs treatment to restore her immune system. Her COVID vaccine can't be around the same time as those treatments, so her cancellation completely messed up her treatment schedule. She is also a teacher. A senior facing an upcoming cancer surgery with a bone marrow disorder and needs a vaccine prior to that surgery. And as she said, with the way I've been treated, I'm ready to move out of Baltimore City. Another senior who maintains a licensed family daycare in Baltimore City, whose clientele can't properly mask up, and therefore she is at a greater risk. And of course, many more appointments of nurses, seniors, and others on the front lines who have had appointments canceled. All the while, there has been appointments siphoned off or vaccines siphoned off to give private providers these vaccines to administer to those that this health department has determined will get to win, while these other 500 people unfortunately are losing. We are supposed to be a team. Your success is our success. If you fail, we all fail. Right now, there's no bigger failure in this rollout than the potential loss of life of these vulnerable people that has been chalked up to technology issues. Please, please, please do the right thing and reschedule all eligible people whose appointments were canceled. If we don't have enough doses on hand, we need to guarantee them appointments as soon as we do. Don't allow these people to lose hope, and more importantly, we cannot allow these people to lose their lives. So the first question I have before I will turn it over to the health department is really just a simple yes or no. Will you help restore trust and have your team reschedule those appointments who are abruptly canceled?
Thank you, Chair. Unfortunately, at this time, given the scarcity of supply of vaccine, we aren't able to guarantee an appointment at our vaccination pod.
Okay. My second question then on that, why won't you reschedule those people who were canceled last week, but you've had Mercy vaccinate others whose appointments were previously canceled due to other technology issues?
Early on, we've had issues with overbooking, and that's something that we've known about the PrepMod system, which is the state's vaccination, registration, and appointment scheduling system. At the time when we were able to work with Mercy, we did have first doses available to go to Mercy for those overbookings. The issues with PrepMod, and I do have a presentation you'll see, are things that we've brought to the state's attention for weeks, and they have largely gone unfixed. At this time, again, starting second dose appointments last week, we did not have additional appointments to share. We also know that individuals that signed up previously in the overbooking were signing up through links on our site. We weren't able to cap appointments. So they were signing up, not on our site, I'm sorry, signing up through links that we had emailed out. The system just wasn't capping appointments.
Okay, did you want to make your presentation now before we get into committee's questions? Or would
Sure.
we jump into questions?
I'd like to make my presentation first, if that's okay.
Sure. Who needs screen sharing?
I thought that we had sent that slide, those slides in. I believe those were emailed in by my team. If not, I can try to pull them up on my screen.
I mean, we just like minutes ago received an email from Richard. But if you want to go ahead and pull it up, I can give you screen share ability.
Okay, give me a second. All right, I have them up, but it doesn't appear that I have the sharing ability yet.
Okay. Do you see the share button on the bottom that I can, if you click that, I should be able to approve you?
Yep, mine is completely grayed out, so I can't click it.
Gotcha. Okay. Give me 1 second.
Mr. Chair, if you go to the participant icon at the top, it'll give you options, and that's one of them.
Okay. Dr. Durazo, do you see the ability now? I just sent it over.
All right, there, sorry about that. Can you guys see this okay?
Okay. I can.
We can see it.
Yes.
All right. All right, perfect. So again, thank you, Chair, for this opportunity to talk a little bit about the work that the Health Department has been doing around the COVID vaccine rollout. Just to quickly highlight what I plan to talk about today, I do want to talk a little bit about PrepMod, which is the system that we're using that provides support with registration and appointment scheduling. I'd like to talk about some of the challenges that we've had to date, as well as some current fixes and supports that have been requested of the state, as well as the status of some of those requests. I'd like to talk about how we've prioritized and how we've allocated vaccine, certainly to individuals that we're vaccinating, but also to partners that are supporting us in this work. I will go into detail about our pod distribution to date, as well as what we've allocated to partners. And then I'd like to talk about an equitable approach to vaccination and review the data that's currently listed on our COVID-19 vaccine dashboard, which went live a few days ago. All right, so just to give a little bit of background about PrepMod, which I've mentioned, this is a system that all local health departments have been instructed to use for scheduling of appointments and registering of patients. It's the state's online registration system, and again, currently just local health departments here in the state are using it. Many of our hospital partners and FQHCs are using their electronic medical records. We are able to utilize the system to email out personalized links to individuals for the purpose of them scheduling their own appointment. Unfortunately, there isn't a mechanism that could prevent individuals from broadly sharing those links out. We have experienced throughout our use of PrepMod where more individuals can be scheduled and there are actually appointment slots available. When we last spoke to a PrepMod representative on February 3rd, they indicated that they thought this issue was now resolved. We're still assessing whether that is resolved or not. So just to go into a bit of detail, the maximum number of appointments when you set a maximum number of appointments within PrepMod, it can sometimes still allow more individuals to register for appointments. And again, we've seen issues with overbooking from the beginning. It won't stop, the system won't actually stop an individual from scheduling an appointment, even if they select an option that's not actually feasible. So for example, at our site, we're only delivering Moderna vaccine, but in PrepMod, because it's being used across the state, you can actually select Moderna or Pfizer. Even though we don't have Pfizer, an individual can still select that as their preferred vaccination of choice. So some of the challenges to date, again, anyone who has a registration link that's been shared with them can schedule an appointment. And if there is an open appointment slot available in the system, as I mentioned, the system doesn't necessarily always cap the actual appointments. PrepMod also doesn't allow for what's called patient profiles. So anytime a patient enters into the system, they're counted as a unique patient. And that makes it difficult where it would be ideal to judge batch schedule individuals that come for their first dose. We're not able to do that using that system, and individuals have to go back in and reschedule a new appointment. Again, when an appointment is booked, PrepMod does send a confirmation email automatically to that individual. However, when an appointment's canceled, that notification isn't necessarily sent to the appointment holder. And I'll reiterate, many of these issues we've brought up to the state who's working on this system. Additionally, we've noted that sometimes the automated messages from PrepMod do go into people's spam filters, so they may not receive them. And then what we've experienced on site is that PrepMod as a system has gone down, which at times, especially early on, had led us to having to use paper as a backup. Additionally, PrepMod can generate extra slots or extra appointment slots above the actual quantity that is allowed. So to date, again, we've been in contact with the state since the end of December on many of these issues that we've noted. The health officers across the state have regular calls with the Maryland Department of Health to talk about all things vaccine related, and PrepMod has certainly been a topic of discussion. On January 26th, the state actually reached out to the larger jurisdictions who were having more of a challenge just because of the sheer volume. They reached out to the larger jurisdictions to help begin addressing some of the issues with PrepMod. They reached out to the health department individually, just the Baltimore City Health Department on the 31st, after we had been communicating all of these challenges. Again, we were told that the overbooking issue is supposedly resolved, but there are still some outstanding concerns that remain. And we're just continuing the constant feedback with the state around those concerns. So we did get an email from PrepMod indicating that there were a few things that they had been able to fix on the list of things that we needed fixed. And by we, I'm going to say collectively, there are other jurisdictions across the state that have challenges as well. The ability to send a link to an individual, they've changed it to deploy it in a way that it will only work with private open clinics. So again, they're trying to fix this overbooking issue that we've noted. They're going to be running reports regularly to monitor for any future occurrences that we identify. Again, I think they recognize that this problem is complex, but they're working to resolve it. They've added additional support on their help desk. They were also being bombarded with calls from residents that were seeking to get vaccinations, and we're calling them to attempt to get those vaccinations. We understand that funding has been secured to stand up something called a Tiger Team that will address some of the enhancements and concerns that health departments have requested. And they've changed a couple things about the users. So now vaccinated users have an option in the message center, enabling local health departments to just send our communications to those that have already been vaccinated. They also were able to fix an email bug where canceled and rescheduled clinic emails to registered patients is no longer incorrect. So shifting gears a little bit to talk about vaccine allocations to date, and I wanted to start with the prioritization mandates that we've received from the Maryland Department of Health. So on January 21st, we received notification from the Maryland Department of Health that as local health departments, we should focus our resources specifically on older adults. So those over the age of 75 that were in phase 1B, and as January 25th hit, older adults again over the age of 65 that were in phase 1C. We were also directed to set aside at least 100 doses per week to support phase 1B educators in our jurisdiction. Likewise, we were given a directive to ensure that we had second doses available. So to guarantee that there was that second dose availability for individuals coming for a second dose. So delving a little bit deeper into our allocation, we had always planned for our February pod to be focused on second dose appointments. So again, because we're using Moderna, which requires 2 doses 4 weeks apart, we knew that week by week, we would need to mimic everything that we had done in January. So our first week in February clinic would need to look exactly like our first week in January clinic, and focus on providing second doses rather to those individuals that got their first dose that very first week of January. So again, knowing this, we made plans, and we had been working with many of our healthcare partners once we got the go-ahead from the Maryland Department of Health to redistribute any new first doses to those providers so that they could help support providing first doses in the month of February. In the third week of January, we noticed that there were overbookings for the month of February. And again, a number of those individuals that were overbooked were scheduled for first dose appointments. So again, we knew that this clinic was designated to second doses. So we believe that a portion of these individuals were likely new first doses. They were coming in for their first dose. We didn't directly cancel that appointment because what we've also seen is that sometimes individuals who are coming in for their second dose might incorrectly select a first dose. So we didn't want to blanket cancel anyone who had a first dose scheduled, so that we didn't miss those that really did need their second dose. But we did send out mass communication, as well as posted through our social media and our website, that the month of February, again, was devoted and focused to providing second doses only. Again, using that prioritization schema that we received from the Maryland Department of Health. So again, what we've done, so also in January, we stood up our Maryland Access Point. We expanded the reach so that it began to pre-register older adults telephonically who may have trouble navigating and scheduling an appointment online, or there just weren't appointments available. So that once vaccine became available, we could easily pull from this list of older adults in Baltimore City that were over the age of 65 that had indicated an interest in scheduling an appointment. Additionally, we have many relationships and partnerships with our senior housing sites. So that's also a key component of our strategy, to really look at older adults, again, over the age of 65 in senior housing sites, and deploy mobile vaccination teams to those sites. Additionally, per MDH guidance, we've been setting aside at least 100 doses per week for educators. And I say at least because there have been weeks where we've set aside more. And then lastly, we've provided a focus on our special population. So specifically, our homeless residents living in congregate settings that are also very high risk. Of note, since we opened up that MAP call-in list January 20th, we have over 18,000 older adults that have already pre-registered. We've been able to refer over 3,700 to those healthcare partners that are helping to disseminate first doses throughout this month as well as last month. So just going through a breakdown of our allocations to date, on December 23rd, we received about 100 doses. So this was really a test run from the state. And those doses were used to allocate our staff that would be supporting our vaccination pod site. The following week, we received 2,600 doses, and those are largely the doses that we use in our first week and a half, 2 weeks of vaccinating, which launched on January 5th. The following week, we received 5,100 doses, and the week after that, we received 4,100 doses. We did not receive any new first doses on January 19th, but did receive our first allocation of second doses. On January 25th, we requested that a portion of our allocations be distributed to our federally qualified health centers. We requested that our large FQHCs get 500 doses each, and thereby decreasing our dose, but recognizing that these partners could distribute to, again, many that we had deemed as priority groups. On January 28th, this was just a few days later, we weren't scheduled to receive first doses on this day. Anyway, this was just our second dose allocation shipment coming in at that 4,000 dose. On February 2nd, the week prior, we had requested 10,000 doses. We got 2,000. Again, on the 5th, we requested 8,700 and got 2,000 as well. So as far as appointments, as well as that we've been able to support throughout the dissemination process, that very first week, again, we were vaccinating internal staff. We were able to vaccinate about 61 individuals. Those that didn't get vaccinated in that first week, some of them were able to attend this very first pod. Again, that first week of the pod, we did start out doing about 250 doses per day. Because it was our first week, wanting to gradually ramp up and ensure that we could handle whatever capacity came through. The week of January 11th, we did 2,329 vaccinations. And again, we had a waiting list of about 24 folks. The week of January 18th, we did a little over 2,200 vaccinations and had a waiting list of about 96. The week of January 25th, we gave 2,308 vaccines and had a waiting list of 182. And then on February 1st, again, this was just the first few days of our second dose pod. We gave 833 vaccines. Again, this does not take into account all of last week, just those first few doses. And you can see that we had a waiting list of about 506. So talking a little bit about what we've been able to distribute to partners. So MedStar is one of our partners. That was a partner that the first partner that we began to do our mobile response teams with. They've been able to support senior housing sites in the South Baltimore region. They've also provided support to both public and private educators. We allocated on the 28th 200 doses to MedStar. On the 29th, we provided Johns Hopkins Medicine with 100 doses for public educators. We've provided Mercy with an allocation of 2,000, as well as 1,500, two separate allocations to support older adults, as well as public and private educators. GBMC, who supports the Helping Up mission, they're right next door to Helping Up mission and provide them with medical care. We've allocated 400 doses to GBMC. We've also have planned allocations to Healthcare for the Homeless to support homeless individuals. Project Place, which is another resident supporting homeless individuals, we've allocated 100 doses to them. Green Spring, again, another homeless support site, we've provided them with 100 doses. We've given another 100 doses to our mobile response team to support older adults in senior housing sites. Again, we've provided additional doses to MedStar for older adults as well as educators. We provide additional 200 doses to older adults and are providing 600 doses to, again, our federally qualified health centers and older adults. Again, keeping in mind that we have that list of 18,000 older adults that we've been collecting since January 20th that have pre-registered once vaccine appointments become available. So just a little bit of a breakdown of some of the reports back that we received from our partners that are supporting. So again, MedStar was able to provide vaccinations to all to city educators. They provided about 100 doses to city educators. We don't have a breakdown of the percentage that were city residents. MedStar, again, has supported those in low income or senior housing. They've given out 70 of 100 of those doses. Again, though residency is not reported, Though residency is not reported, I think I'm automatically scrolling. Hold on. All right, my apologies for that. So the residency is not reported for those that MedStar provided. Again, they're going to senior housing sites, so we know that those individuals are typically residents. Mercy, again, did support some with pod overbookings very early on in the process when we had additional first doses. They've also supported educators, both public and private educators, as well as those over the age of 65. So they're helping to call individuals off that list that we've received of 18,000 older adults that are interested. Again, the majority that MedStar has been able to provide in terms of our overbookings, as well as ours older adults over 65, have been city residents. GBMC, which is supporting Helping Up mission. Again, we have 211 that are either have been administered of their 400 dose allocation or is scheduled, and 82% of those individuals are noted to be city residents. So looking a little bit more into detail, and again, this information can be found on our website. We did launch our COVID-19 vaccination dashboard to indicate where we are in the process of vaccinating. And this is up to date as of last night, so we do have additional doses that have been added today. But close to 47,000 Baltimore City residents have been vaccinated, which account for almost 8% of our city population. Breaking it down a little bit further, we do have representation on that dashboard by gender. And when we look at gender, the way that I'll describe it is we have the total number, so close to 17,000 men in the city have received vaccines, and that accounts for 6.1% of the male population. Likewise, close to 30,000 women have received the vaccine, and that accounts for about 10% of the female population here in Baltimore City. When we look at first doses administered by race, again, about 14,500 of those doses have gone to African Americans, which account for a little less than 4% of the African American population here in the city. A little over 22,000 have gone to whites, which account for about 12% of that population. About 18% of the Asian population has been vaccinated. Almost 6% of the American Indian, Alaska Native population have been vaccinated here in the city. About 21% of the Native Hawaiian and Pacific Islander race have been vaccinated here in the city. We have some individuals that have identified as other when selecting race, and then we are missing data that was not reported for almost 4,000 individuals here in the city. So looking a little closer at ethnicity, about 4.4% of the Latinx or Hispanic community have been vaccinated here in the city. So looking at an age breakdown, again, not very many vaccines provided to the 5 to 19-year-old group. Currently vaccines, Pfizer's approved for 16 and up, and Moderna's approved for 18 and up, so that number is not surprising. Looking at the 20 to 34-year-old age range, almost 10% of this population have been vaccinated at 14,922 doses. For the 35 to 59-year-old age range, 16,598 of those individuals have been vaccinated, which accounts for about 9.2% of that population. For the over 60 population, 15,356 of that population have been vaccinated, which accounts for 12.3% of that age population. So also looking at just the top 3 zip codes, and this is highest overall numbers. This is not a percentage. 21224 is the highest as of yesterday at 4,721 doses provided. 21230 has 385 doses, so ranking 3rd, and then 21218 has 3,916 doses provided. So that was the overall city data in terms of vaccines provided. To look a little bit more closely at our pod data, I did want to share some numbers. So again, this is just specific to first doses at the health department pod, and starting off with age, we see that again, relatively low number for the 5 to 19-year-old age group. Again, just very much related to the age that these vaccines are approved in. 20 to 34-year-olds accounted for 2,116 doses, which was about 26% of all doses that we gave. 35 to 59-year-olds accounted for 4,237 doses, which was about 52% of all the doses that we gave. And then those over 60 accounted for 1,671 doses, which was about 20% of vaccine that we provided. Looking at the total numbers, again, just specific to the health department pod of our first doses given by race, African Americans account for 2,193 doses, which is about 28% of total vaccines that we've administered. Whites account for 5,082 doses, which is about 63% of vaccines, of the percent of vaccines that we've given. We see that Asians account for about 5%, American Indians or Alaskan Natives about 0.42%, again, Native Hawaiian or other Pacific Islanders, 0.17%. Other races account for about 3%, and then we are missing data for a small percentage of people. Also looking at our pod specifically and how much of the first dose has gone to Baltimore City residents versus those in other jurisdictions. About 54% of our doses have gone to city residents. About 28% have been county residents. We see that Harford County as well as Anne Arundel County account for a little less than 5% each. Howard County accounts for a little over 3%, and then other is close to 7% of our pod. So this is a shift. So this actually represents the total numbers of individuals that have received first doses at any administering organization here in Baltimore City. So not just the health department, but anyone who's gotten a COVID-19 vaccine by any healthcare provider or organization here in Baltimore City. And we see that across the city, about 37% of all citywide vaccines given have gone to city residents, while Baltimore County accounts for about 33% of all doses given. Howard County, as well as Anne Arundel County, again, a little less than 7% each. Harford County accounts for about 5% of all vaccines given here in the city. Montgomery County is around 4%. We see a small percentage of out-of-state individuals accounting for a little over 3%, and then others about 5%. So our approach to equitable vaccine dissemination, and some of this I did pull from the presentation a few weeks ago, so I will go through it a little bit quickly. But we are looking really at a volume as well as a focused strategy. We recognize that there's a significant need to have mass vaccination sites to serve a certain portion of the population, but we also recognize that there's a need to be very focused in providing care and support to individuals who are highest risk and highest need in critical areas throughout the city. So that really involves a combination of working with partners who are trusted in the community to provide vaccine, working with pharmacies, working with federally qualified health centers, as well as a deployment of mobile vaccination teams that can meet residents where they are. So again, looking at the breakdown, there's the mass vaccination pod. This is again a multi-level strategy. There's the mass vaccination pod, which we know will serve a large portion of Baltimore City residents and serve a large portion of the population. This is well suited for individuals who are upwardly mobile. This is well suited for individuals who have access to transportation or can easily access transit. We also know that there is a need for using a standard healthcare model. So being able to go to your physician and get a vaccine, get a COVID-19 vaccine, just like you might get a flu vaccine or you might take your child in for school vaccines. That's really the neighborhood-based approach. So that's the utilization of our federally qualified health centers. That's the utilization of our pharmacy partners. And then at the very tippy top, when we think about, again, our special populations, and they're special because these are individuals who are at highest risk for the most severe outcomes as a result of getting COVID-19 disease, there really should be this focused mobile deployment, which is a lot of the work that we're doing with our hospital partners who are deploying mobile response teams. So again, we've outlined this before, but at least 80% of the population, we have a goal of at least 80% of our population being vaccinated by February 2022. And again, pending supply, we would like to see this happen a lot sooner, but that does give us a target of about a little over 67,500 by April 30th being vaccinated. Additionally, we'd like to see 54,000 vaccinated using our existing hospital facilities. So again, that's our federally qualified health centers, that's our hospitals that are vaccinating. We'd like to vaccinate through our mobile response teams at least 13,500 again by April 30th. So some of our approach, we've talked about the mass vaccination pod, and certainly we have our mass vaccination site, which will be continuing to distribute. The plan will be to resume first doses in March or April, assuming that supply is available. And then we will also are continuing to distribute to our hospital partners to do first doses throughout this month. We know that the state has launched the convention center as a mass vaccination site, or in the process of also launching M&T Bank Stadium. We'll continue to reallocate vaccine to partners. So again, we have many hospital partners who have volunteered, and we'll work from that list of 18,000 older adults that we already have pre-registered for vaccine once it's available. And again, this is that neighborhood-based approach. We're also working with our pharmacy partners. So we know that when the federal pharmacy partnership came in, their responsibility was to focus on nursing facilities as well as assisted living facilities. But we don't believe that they were able to vaccinate everyone during that initial visit to those sites. So we'll be working with those same pharmacy partners to go back and ensure that we're able to reach those residents that may not have been reached that very first visit. We'll also continue our mobile response team. We've set a goal of having at least 20 mobile response teams in the field at once by this summer through partnership with our hospitals, through Hopkins School of Nursing. Additionally, we're doing an educational approach too, which I'll talk about a bit more in the next slide. So again, we recognize that there's also a need to share information and provide education citywide. So making sure that we're exhausting all media outlets to share information. So that includes mass media, that includes social media, that includes flyers that are being handed out when we do canvassing of neighborhoods. Again, provider education. It's very important that our providers in the field also feel comfortable providing the immunization. So providing them with support that they need to be able to effectively administer and counsel their patients on why they should receive the vaccine. Likewise, when we think about our special populations, very mobilized specific support for that group. So we're doing cross-city listening session with a partner, Morgan State and IVAC, to again garner what are the current hesitations? How do we need to hone our messaging so that it's most effective to those groups that might have the highest level of resistance? So again, we've already launched our year-long campaign to reach the general population. I've mentioned the need for us to continue to support providers so that they can appropriately counsel their patients. And we've launched our year-long special population listening sessions with our partners at Morgan State, MICA, as well as the International Vaccine Access Center at Johns Hopkins. And this will really help to inform messaging and outreach efforts. So again, I talked about some of this, but we did launch our engagement subcommittee. Again, we started our cross-city listening sessions. We're talking to program staff, or we're training program staff across our special populations to be able to effectively support those populations. We've been hosting citywide telephonic town halls focused on older adults. I mentioned the launching of our MAP call center to be able to receive older adults who are interested in pre-registering vaccine once it's available. We've been developing educational materials. We recently released our FAQ document online. We have many partners that have reached out. We've presented this information to our hospital partners, our FQHC partners, and we do provide that information out so that they can also share it broadly. And then lastly, we'll be hiring neighborhood-based vaccine ambassadors to also share this information with our special populations. So again, for our special populations, we've internally identified team leads. So Hyung Tan, who is our Deputy Commissioner for Aging, and Raya Contractor, who works in aging, are the team leads for our special populations. Additionally, we have supports for our homeless and congregate settings, our pregnant and lactating women, our immigrant populations, and our Latinx population, our older adults, our Hasidic community, and our young men of color. So I mentioned just the launching of our communications campaign, the launching of our mobile response team, both of which have already happened, expanding vaccinations at neighborhood health clinics and pharmacies. Again, we've been working with our federally qualified health centers and have had allocations to this group so that they can focus on older adults. Again, with that goal, that kind of initial milestone of 134 residents vaccinated by April 2021. By summer and fall, we do anticipate there being a lot more supply than there is now. So again, I think having the multiple mass sites will certainly be helpful, but there will still need to be this continued focused approach for our special populations. Again, setting that goal of February or March of 2022 of having at least 80% of the population vaccinated. So just some of the metrics that we're looking at internally are the number, percentage of COVID-19 vaccines given by race, ethnicity, age, gender, and zip code. Again, this information can be found on our current COVID-19 vaccine dashboard. We're looking internally at the percentage of our employees that are vaccinated. We're looking at sites across the city where vaccines are being administered. We're looking at percent and number of providers using Immunet. I only very briefly touched on Immunet, but this is also the state system that collects data from PrepMod on the back end that indicates the number of vaccines given, as well as the number of listening and educational sessions that we're able to hold across the city, as well as the number of special population specific mobile response clinics that we're able to hold in the coming year. And that's it.
All right, thank you very much. Yeah, you can take the presentation down if you'd like, and then
Yep.
we'll open up to questions. And while you're doing that, because I know it might take a minute, I saw a bunch of messages, people asking about, why people from out of city and state are getting it. But I assume the answer on that is it's people who are working in the city, including people who work in city agencies and all that, which is why the demographics and the locations and everything are what they are. Is that correct?
Yeah, so if you live or work in the city, you are eligible to receive vaccine here in Baltimore City. I do think, again, this is similar across the state. I would imagine that our residents have also gone out of Baltimore City to receive vaccine as well. Yeah,
absolutely. Again, so in these numbers, that also includes like the police department and fire department and others that we know.
Anyone that came through our pod, yes, this is if they are a city resident, yes.
Okay, I still see this screen up.
I'm trying to, okay, hold on. Let's see if I can figure this out.
Okay.
Stop sharing. There we go. That was simple.
There you go. Thank you. Okay, I will turn it over to members of the committee for their questions. I'm just going to go across in order and how I see you here. So I'll start with Councilwoman Ramos.
Thank you, Mr. Chair. Really appreciate you bringing this hearing, and thank you, Dr. Duraza, for coming. I have a couple of questions. One is, you mentioned the 20 mobile sites. I'm assuming that's actually with a van, and there will be, how would we go about reserving that van for some of our areas, and how's that all going to work out?
Yeah, that's a great question. I will say to start, our focus has largely been senior housing sites. So in the fall, we launched a similar campaign, and that was part of our first run at how do we really outreach senior housing sites and focused on those that are highest risk. So we have a list of over 120 senior housing sites across the city and have relationships with many of those senior housing site coordinators that already exist. And so we've been kind of working through that mechanism to identify senior housing sites that are ready. We have a community health worker that goes into that senior housing site. That person provides education, but they also do the pre-registration part, which is so important so that we understand how many residents want to get vaccinated on that day. So we definitely I would say we can work with Jeff if there is a list of sites that you'd like to make sure that we're hitting. But again, we've largely been focused on starting with our senior housing site just because there's kind of that density of population of older adults. But we certainly want to make sure we capture if there's some that aren't on our list.
Can I follow up on that, Mr. Chair? I have a lot of seniors aging in place, and so I'm concerned about making sure that they also can take advantage of the mobile site. Actually, my senior buildings are getting their vaccines through CVS, and so I would want to, well, except for one. So I would want to make sure that we can get the mobile site into. I'm talking mostly about seniors, but at some point when we're at general population, obviously we're going to need that. So I guess we would communicate with Jeff to coordinate that kind of thing.
Yeah, I would say certainly as there's more resource. I mean, I think similar to mobile testing, there is the desire to really focus on areas that have been hardest hit.
Right.
Like our dashboard again can kind of show, which zip codes haven't had a larger number or a larger percentage of vaccine given, so that once we have more resources available, we can deploy them to the areas in highest need. But yes, please work with Jeff.
Right. And then you had said that you want, and I meant to ask this the other night and I didn't, 80% of the population by 2022. What's your definition of population? Because children do not have access to the vaccine. So if we're talking about 80% of the population, that means every single adult is going to have to be vaccinated if we don't have a vaccine for the children. Is that correct?
So we are hoping that we will get approval for a vaccine for children. We know that clinical trials are underway now, so we are including kids in those populations. We know that not every adult will take a vaccine, but that's also why we've extended that timeline a bit, because we want to give it time for the vaccine to be approved in children. So we're including children in that 80% number. And again, that number was selected because when you're looking at the data, the CDC says about 70 to 80% of the population has to be immune for there to be some level of herd immunity.
Thank you.
No problem. I have another one, but I'll get the next round. Thanks.
Gotcha. The next one up is Councilman Burnett.
Thank you, Mr. Chair. Are you able to hear me? Okay. Am I coming in okay?
Yes. Mm-hmm.
Okay. Thank you, Mr. Chair, and good to see you, Madam Health Commissioner. So I was trying to make the connection here. So you mentioned the PrEP mod system is run by the state. What communication on this issue has been made to our representatives at the Maryland General Assembly around this issue? Because it seems like that they'd probably be better suited to advocate for whatever technology issues made this possible. Can you speak to that at all?
Sure. I know that we've shared, because I have reached out, we've shared some of our challenges with PrEP mod. internally, because again, this is not just a Baltimore City prep mod issue. We've had discussions with other health departments, like recognizing that the message will mean more if it's also other health departments. And so I did present a letter to the chair from signed by other health officers from the larger jurisdictions as well that are having similar issues. But we've shared that, and we had the president of MATRA, which is the health officer, organization across the state, did present on some of these challenges at the most recent HGO hearing. I believe it was last week.
Okay. Yeah, and I think that would be, I guess, helpful for myself and colleagues to advocate for these changes. If there's ways that we can do that, sending a letter, I'm happy to better advocate to the folks responsible for the development of the system, especially if this is something that isn't a Baltimore City exclusive issue. This is something that sounds like there are other jurisdictions having access challenges. I know I was on a call the other day with Senator Van Hollen, and he mentioned that this was something that they were hearing even on the Eastern Shore. So it sounds like systemic in the state technology, and if we can better advocate to make sure that something like this doesn't continue to occur, that'd be amazing.
Thank you.
All right, looks like my screen just moved around to me. Councilman Conway?
Thank you, Mr. Chair. I've just got one real question. Have there been any geographic analyses done around access to testing and vaccinations, given various sites within the city are far away from access? Have we taken a look at that, and is there anything we can do to alleviate that? I know we have the mobile van, but I know it's got a limited capability. It can only be so many places at once.
Yeah, we've done map overlays of testing sites, certainly across the city, since we were doing that form of mobile testing as well. And that's how we were kind of looking to select, what are the other locations providing testing throughout the city. I don't know that we've necessarily overlaid it with vaccination sites, just because there were relatively few in number right now. But certainly that's a good idea, and that's something we can look into.
Thank you, Dr. Draza, and thank you, Mr. Chair.
We're going to roll your second question over to a different hearing, so you get 3 the next time. Next person up is Councilman Costello.
Thank you, Mr. Chair. Commissioner, 2 quick things. One, can you provide a copy of that presentation that you provided, that slide deck, to the committee? And Mr. Chair, if you can include
you should have it in your inbox. Richard forwarded it from the health department right before the hearing.
Got it. Okay. Is that safe to share publicly?
It is. I will say, yeah, we did have one partner who I think was a little bit hesitant. I think they didn't want to be bombarded with calls, but I mean, it's been shared here, so it's been shared publicly.
Thank you. The second item is just feedback. One of the overarching concerns that I continue to hear is, I don't know how to frame this the right way, but there is too much information on the vaccination page on the health department's website. I've been advising people to set aside 20 minutes in order to read through everything that is there. If there is a way to simplify this and get right to how do I schedule an appointment. Also, I think a lot of the context that you've provided around, the constraints that you're at the mercy of with respect to the state and federal government, and the state system that's used to schedule these appointments. I think it would be helpful if that were explained, but again, later on that page. Again, when I send people to this page, 100% of the time, they're interested in one thing and one thing only: how do I get the vaccination? And they're not medical providers. They're not interested in priority groups, background, how the vaccine works, etc. So I share that for your consideration. Other than that, thank you for all the great work that you and the health department is doing, Doc. I really appreciate it. Thank you, Mr. Chair.
Thank you.
Thank you. I would say thank you for that feedback. No, I appreciate that.
Yeah, thank you, Councilman Costello, and also Commissioner. I noticed also on the general information page of on the coronavirus.Baltimore City for the general population, the information is extremely dated. Most of the information is actually 6 months older, if not more, and certainly think this situation has changes by the day. It certainly is a completely different place than we were 6 months ago. So I think it definitely needs to be updated.
Yep, thank you for that.
Next person up is Councilman Torrance.
Thank you, Mr. Chair. Thank you, Commissioner. And I just wanted to send some positive vibes to you and say that I'm thankful for the work that you guys are doing, in spite of the fact that all of our counties are experiencing the same issues with PrepMod. I can tell you from my own experience with PrepMod and helping someone to register, it is not the most user-friendly portal or any type of application I would want to use to help roll out something so significant. But also, one of the questions I have is related to public housing as well as mixed population buildings. Is there any work in prioritizing them as well? Because there's a lot of density in those areas, especially in my district. I have Lakeview Towers, I have Gilmore Homes. I also have a large number of senior buildings where there's just people just sitting there and they're willing to get vaccinated. So I wonder, how can we assist with those populations if we know they're there and they're willing to do it?
Yeah, I think likewise, we'd love to connect your team with our team to talk through those buildings and see again if there's overlap that's existing to make sure that we can consider those buildings as well.
Thank you. And then my additional question is for young persons. The conversation a lot of people have been here is that if you're 34 and healthy and under, should wait if you're in one of these prioritized groups. So that's one of the questions a lot of people have been hearing, or the phrases they've heard from their health professionals. Can you at least expound on that or try to add some context to why they're hearing this from their practitioners?
Yeah, I mean, I think the biggest thing is honestly, it's still such a scarce resource. You know, we at the local level have been told to prioritize older adults, and obviously are providing some allocations for homeless and educators as well. But given the devastating impact it's had on older adults, that is why, you know, we are choosing to focus the limited resource we have on older adults, recognizing, yes, young people can get sick, they can get particularly ill. But we've seen where the rate of death and severe complications is just much higher in older adults. So I would certainly say once the vaccine is more widely available, absolutely. Again, certainly if you're at high risk, but we've been told at the local level to focus on older adults given the scarcity of the resource.
Thank you.
All right, next up is Councilwoman Porter.
Thank you, Mr. Chair. First, thank you Madam Commissioner, for actually coming on tonight and speaking about the vaccination challenges. I know personally, working for a hospital myself up in Connecticut, they are dealing with the same issues that we're dealing with down here. Can you speak to the turnaround time if a person has been dropped from their appointment? What's the turnaround time that they'll be able to get a secondary appointment?
Yeah, so right now it's challenging because there are lots of different access points. So again, as I mentioned, we're only providing second doses for the month of February. We do have other healthcare partners that are doing first doses, but all of them, you know, like us, will have some level of a waiting list. And again, the doses that we've given them, we've asked them to prioritize those that are pre-registered on that MAP pre-registration list that we have. So I think it really does vary from provider to provider. And I don't necessarily, I'm not able to dictate how they're making decisions around, you know, who is to be prioritized, you know, among this large pool of people who are eligible at this point.
Sure. Okay, and then my second question has to do, well, my second comment, also echoing Councilman Costello and Councilman Torrance. If we can add some sort of like pictorial diagrams to the Baltimore City kind of resource pages. We have a large, population that cannot read. And so even if, they want to schedule an appointment, they don't know where to schedule an appointment. And so just having some sort of pictorial depiction will be very helpful in like the community health worker space and like just the external space, not only on our kind of like websites and hyperlinks, but also in our resources that community health workers and providers are handing out as well. So thank you so much, ma'am.
Thank you, Council Vice President Middleton.
Thank you, Mr. Chair, and my sentiments are the same. Thank you, Doctor, for all the work that you continue to do to get everything on track with this virus and getting the vaccination. And I apologize if you touch this, but I know that you're working, trying to get the senior apartments going. We have a number of small assistant living quarters as well, where, it's maybe 10 to 15 seniors in an assistant living home. Is that also connected with the senior apartment? You're saying the same path?
Similar. So our assisted living facilities will be working with our pharmacy partners to do outreach and vaccination for our assisted living facilities. So the nursing facilities and assisted living facilities, many of them were part of the federal pharmacy partnership where pharmacies came in directly and did the vaccination, but we know that there were sites that were missed. We have a list of all the assisted living facilities throughout the city. And so we're now partnering with our pharmacies who kind of did that initial pass for a lot of those ALFs to go back to assisted living facilities, us helping with the outreach portion, because we know that, again, they came in and maybe weren't able to do the outreach, but we would help with the outreach portion and they would come and help vaccinate those sites.
Right, thank you. And I know that there's been a good partnership with the Office of Neighborhoods and canvassing and going through communities as well, and especially through that 21215 area. So I do see some good benefits from that taking place. So I just wanted to kind of give that shout out. And Jeff Ambrose has just been phenomenal in answering calls and responding in a timely manner to just quick emails that we seem to get. So thank you for having him assigned to that.
Thank you.
All right, thank you. I do not see any other council people, so I'm going to continue with my questions. I see on your slide deck where 3,500 vaccines went to Mercy. 1,500 of them were in the week of 2/5. You also have GBMC, 400 of them in that a day actually before these appointments got canceled. So that's 1,900 doses that went out the door the same week that these appointments were canceled. So I have a question about that. Did you speak to anybody in the state health department? Obviously, it's pretty widely known at this point that there's issues with the state system. Most jurisdictions put up an alternative page to it, like Baltimore County had something going within 24 hours to address a lot of the shortcomings in the state system. Being that we know where the issues were, have you spoken to anybody? Has anybody on your team spoken to anybody in the state health department to say, look, here's this issue. We're going to have to notify these 500 folks that we don't have the vaccines for them. Well, actually we did, but that we're not going to be able to fulfill those appointments. Did you guys ask them to give us another 500 just to resolve that situation since it was a 1 week issue?
So we, again, have been in communication with the state about requesting allocations once we had the ability to be able to request, and we had already been notified what we would receive for the week. And it was far shorter than what we had originally requested. So again, many of those requests have not been honored at this point. So, we figured we would not really get a response again because we had already made a request for allocations that was well above what we actually were allotted for that week.
Well, according to the state health department for that week, they claim that in the beginning of that week, we still had 3,800 first dose vaccines on hand. And so who's responsible and how often are we communicating to the state when vaccines are being allocated? Because we know and we've seen that jurisdictions, I could use Baltimore County again as an example, they're updating them very frequently, and therefore they're demanding on a very regular basis more doses because they're using them up. The state health department obviously felt that we had 3,800 on hand, which I did communicate to your team. So where is that breakdown, and how often are those conversations happening?
So we report to the state each week when we reallocate to partners. We've noted that they're not including that reallocation in their updated numbers on the website. Though I've had conversations with the lead at the state, I know our team has had multiple conversations. We finally did get an email earlier today that they counted some of what we had, but they didn't count all of it. We have a general email address that we send our weekly reallocation, amount to. And we've asked, is there another email address we should be using? And we've been told to continue using that address. But again, I communicated that to higher ups at MDH last week that it's not being updated, and that's problematic.
I will turn it over. I know Councilwoman Ramos had another question. I just did too, so I'll turn it over to you.
Thank you, Mr. Chair. I really appreciate it. Dr. Terraza, you had mentioned about doing, a lot of concerted work. Concerted work around, trying to get to the populations that have been very hit hard. And I'm excited to be part of the campaign to get to the Latinx community. Can you talk a little bit about how we're going to address those who, have different, are English is not their first language and is not their main language, because prep mod is horrible for anybody who speaks Spanish or any other language, because it's not nothing except for really horribly translated Spanish is on prep mod. So I know you're working with MIMA, but it sounds to me like we're going to have to put up an alternative site in order to actually address the language issues. So can you let us know how we're dealing with that?
Sure. I completely agree with you. Prep mod, and I think maybe Councilman Torrance mentioned, it is not user friendly at all, even for people who are very computer savvy, and we recognize that that's problematic, and that's also an issue that we've raised to the state generally. So again, we have a lot of lessons learned from our flu vaccine campaign in the fall, and we have designated Latinx population leads. So that will, similar to how we're working with the homeless population, those leads will go in and will help potentially with pre-registration. So similar to what we're doing for our older adults, likewise again with our homeless population, there's going to have to be support to do that pre-registration ahead of time, so that they're that individuals aren't necessarily having to navigate a system that's hard to navigate, even when you are, particularly challenged. So again, we'll be working with MIMA, who's been a great partner from day one in this work, and we'll have community health workers that are fluent to support, similar to how we're doing for other special populations.
Will there be a special number that folks can call to get a Spanish or other language translator? Is that how that's going to work?
So I think we're still sorting through. We have worked with, I know CASA has set up kind of a call-in line, so we may be working with them. But again, we have a special populations subcommittee that is focused on the Latinx community, and we would love to team up with your team if that's possible.
Oh yeah, we're ready. And then also, I had a question about how we're going to do this moving forward, because you just said that February was second dose only, and we get only 10,000 a day at the moment, so half of that has to be allocated for second dose. It's almost as like we have to do like some specific spacing out to make sure that the people who get dosed then get second dose 4 weeks later, and I think this is a statewide issue. But what is moving forward? How do we do that so that it's very strategic? Like we're just going to do our seniors, and then we've got to make sure that they're it's almost as if we've got to take what the governor said and just do what we want to do so that it can actually be spaced out properly so everybody gets the second dose without the people looking for a first dose, getting angry because they can't get an appointment, right? So the spacing issue, timing issue, I guess is a better way to talk about it.
Yeah. And again, there's 10,000 across the state per day. So again,
Right,
relatively,
exactly. I'm sorry. Yeah.
relatively small number across the entire state. And so definitely a challenging issue. Again, I think that's why we've looked to reallocate to partners so that we're kind of all in different phases, right, of administration. So again, doses that we get, if we can allocate those to our federally qualified health centers or our hospitals, they can still be doing and are still doing first doses for this month, though the health department is not doing those.
Okay, thank you, Mr. Chair.
Thank you, Dr. Durazo. Can you just elaborate on one thing? I think I might have missed it. You were saying about 10,000 shots a day. Was that's
across the state? That's
okay.
Not in Baltimore City. Yeah.
Okay. I mean, for clarity's sake, according to the state, the state claims they're doing 25,000 shots a day. So I assume that's a combination of first and second doses, but that's certainly a lot more.
Not enough. Yeah.
Okay.
I'm sorry, Mr. Chair. I think that was an updated number. I think the state is finally making more available and getting them, but that happened like yesterday. So.
Yeah.
Okay. Councilman Costello, do you have anything else? Is that a yes or?
It's buying me time to find the unmute button.
Okay.
So thank you, Mr. Chairman. Doc, can you talk a little bit more about the strategy for senior buildings?
Yeah, thank you. So the mobile vaccination teams, again, we did something very similar in the fall. We had community health workers that would work with the senior housing site coordinators to identify residents who would be interested in receiving a flu vaccine. We're doing the exact same thing with the COVID-19 vaccine. So we'd have our community health workers go in first, identify those residents, working with the senior housing coordinator. In this instance, with the COVID-19 vaccine, we're able to pre-register those individuals. So we're able to pre-register them, schedule an appointment, say that we have a mobile team that's coming back next week to provide vaccinations to residents on site. So again, when that community health worker is going in addition to providing education and answering any questions that the resident had, as well as pre-registering them, they're evaluating the space. We know that it's important to be able to socially distance people. Is there a community room that needs to be set up to be able to support? Are we able to go and just schedule different slots for individuals to come down again so that we can appropriately social distance people when we go back with the clinical team to provide the vaccine? So again, we've launched this. MedStar was one of our partners that used their mobile van to be able to provide this work. Again, in some cases, the mobile van can even be also used to provide the actual vaccination, but that's how the clinical team is traveling to those sites.
Mr. Chair, I have a number of kind of rapid fire questions that are one sentence questions in response to that. I want to respect your 2-question limit. Would you prefer I hold those until the end?
No, why don't you give it to us?
All right. Thank you, Mr. Chairman. Appreciate you indulging me. I noticed in the press release that Cherry Hill Senior Homes had been completed, I think, on January 29th. Have there been other senior buildings that have been that we've done this mobile clinic with?
We have another one scheduled for later this week, and I think there's 2 more scheduled for next week. But I can work with my team to get you a specific list if you're interested.
Okay. Is there a methodology behind how we're selecting which senior buildings?
So a couple things. One, we have identified partners who are interested in supporting, so they have the clinical staffing available. Some of those partners, it's somewhat based on their catchment area. So for instance, MedStar is our partner in South Baltimore. That's their catchment area. These are buildings and residents that they're already serving. So providing some level of support, but it's also based on, again, identifying a need, right? So we recognize that, again, similar to testing, there is not as much access in South Baltimore. So we've wanted to ensure that there's access to vaccine in South Baltimore. We are scheduled this Friday to go to Sharp Leadenhall. Again, some of it is linked to who the partner is. And so what is the neighborhood and who are the residents that they would already be serving? But again, we have partners across the city and have tried to be, relatively focused on, okay, we recognize that this is an area of high need. I think as we get more mobile teams, we'll see even more expansion and the ability to select even more high need, high risk locations.
So saving all my other questions, most important question to me is, can I get a meeting with, who would be the appropriate person for me to meet with at the health department to go through the list of 14 senior buildings in my district to make sure I understand when they're up in the queue, who that partner is going to be, and whether or not you need assistance working with ownership, management, or resident service coordinator or tenant association president within each of those buildings?
Sure. So I would say if you can start with Jeff and we can redirect it to the particular lead.
I'll reach out to Jeff tonight. Thank you, Doc. Appreciate it. Thank you, Mr. Chairman.
That's your rapid fire?
I cut out like 7 questions by asking that last one to save everyone the headache of listening to me talk. Thank you, Mr. Chair.
No problem. And Dr. Draws, I'll let you take a break for a minute and get a drink while I ask some questions of Mr. Scott Brolman over here, who's been just sitting very patiently, our Baltimore City logistics expert. And so my question for you, Mr. Brolman, is what role has emergency management played in the logistics of this entire operation? I personally have been down to BCCC multiple times. It's no surprise to anybody, some of the issues that I saw there. And I'm just curious what role you guys have played in this and what role you guys continue to play.
Mr. Chairman, members of the council, thank you for having us and thank you for the question. OEM, since the beginning of 2020, has been coordinating interagency response and also recovery to this pandemic. Even before the pandemic hit our shores, we were prepping. We were centralizing procurement and centralizing supplies. One of our first large coordinating efforts was the construction of the largest testing site in the state, which was at Pimlico Racetrack. This was a drive-through site. It was a drive-through operation, but the site took a tremendous amount of logistical support. It took multiple agencies, the private sector, the National Guard, all the health professionals from the health department. And the staffing was a tremendous effort. But one thing about the testing site then was that the testing kits were consistent. We knew we had a bunch. We knew we could stay staffed up through weeks ahead, and it's different now with the vaccinations. But since then, OEM remains all hands on deck. One of the most recent all hands on deck efforts that OEM has coordinated was getting our EMS, our emergency medical services providers, into the fight. So our EMTs and paramedics from the fire department are now shoulder to shoulder with our nurses and doctors from the city, putting vaccines in arms. So, when you go to a site, you'll see a paramedic there assisting. And Chief Ford, he let it happen, and it's working out great. And we're able to scale up and scale down depending on, the health department's need. So as more supplies come in, as more vaccines arrive, we're able to scale up and scale down and support the health department. And we'll continue to do that.
So when you keep mentioning about support, so obviously we've worked together on emergency scenes such as the explosion and other incidents throughout the city. So when you say assist, are you guys the ones running point on the COVID emergency in total, or are you just like any other agency that is here to support anything that's needed?
Yeah, so the role of emergency management is to support the coordination of the agencies. So in a pandemic, the public health service, the Baltimore City Health Department is the lead agency. If it was a law enforcement emergency, the police department would be the lead agency. If it was a fire, of course, the fire department. So we would support coordination between all the city agencies, the state agencies, and the feds and the National Guard. And that's our role here. We help organize it, and we help whatever needs they have, we help support them with it.
Okay. I mean, what I'll just say on that, and then I'll move on to the next council person, is that you guys are clearly experts in logistics, and there's certainly a lot of logistics that play out through the pandemic within multiple different agencies are impacted. And so I would just hope that you guys can play a more active role in logistics just across the board and everything that's going on. We're heading into what's going to be a major logistical challenge as it pertains to running mobile sites and other locations and really trying to fan out. And that certainly is a logistical job. And I think that you guys would be excellent people to run point on the logistics and let each agency handle what their level of expertise is. So I just ask that you guys play a more active role moving forward. Councilman Burnett, do you have any questions?
I'm good, Mr. Chair.
Okay. Councilwoman Ramos?
I just wanted to publicly acknowledge Captain Brillman for answering my text on Christmas Day about a family who was displaced, and we were able to get them housing that evening. So I really appreciate it, and he knew exactly what needed to be done. And so I really appreciate his time, and also, working with all of us on this particular issue as well. So thanks a lot, Captain.
Thank you, Councilwoman Ramos.
Councilman Torrance?
Thank you, Mr. Chair. I have no questions at this time for Captain Berlin, but good to see you.
You can ask anybody a question if you like.
Thank you, Mr. Chair. My only question was a follow-up to the health department regarding when can we expect any updates about when the software will be updated based off of the conversations they've had with the state? That's one of the lingering questions I have, because I know that the largest jurisdictions are coordinating with the state on when these updates will be made to the site, so we can manage those expectations. But my other question would be also, how are we going to support some seniors in registering when we're able to do first doses again?
Yeah, so I'll start with your second question first. So again, we have that pre-registration link. So I would urge older adults or their caretakers, maybe that can't access, the internet or just are having trouble navigating. So call that MAP call line 410-396-2273, and we do have that pre-registration going. So that we can pre-register those individuals. And again, that's the list that we're sharing out with our hospital partners that are providing first doses from the allotments that we've given them. Again, we're getting probably weekly emails from the state on where they are with addressing the concerns that we've raised. So we're getting those on a weekly basis, and we have weekly health officer calls where we sometimes get updates on kind of where they are with PrepMod, with the updates that they're supposed to be putting in place.
Thank you.
Council Vice President Middleton?
Just one last thing comes to mind. How is the aging commission involved? Or is there, a partnership, or are they some of those representatives helping out? Do you have a plan for that?
Yeah, thank you for that question. So I didn't talk in as much detail, but we do have a communication subcommittee. And so that communication subcommittee, as well as a kind of an external task force that includes partners. And we do have representation on those committees supporting specifically again, our messaging for older adults, as well as how we'll disseminate to older adults.
Thank you.
Okay, Councilman Conway?
Thank you, Mr. Chair. No questions.
Okay, my turn again. So when we're looking at some of our external partners, and each one is serving different purposes according to the spreadsheet, I appreciate you spelling it out, who's doing what. Who's deciding who gets selected in those, for those vaccines?
And so who the external partners are selecting for vaccines?
Yeah, I mean, we're giving them vaccines to vaccinate people who I assume are requesting them through the city health department. So who's making the determination who goes next?
So we've given them a list, again, that 18,000 older adults list. We also surveyed non-public school educators and received lists from them of who was interested in getting the vaccine. And so we've provided our partners with those lists to work from to begin to schedule individuals for vaccine at their sites.
So is there like an order or a rhyme or reason of how it's working? Like, is it working from the oldest person on down? What's the flow?
So it would have been how they pre-registered, so the order of pre-registration.
So you're saying a 65-year-old who registered before and a 105-year-old will get it first?
Currently, it's based on the order of how individuals have registered.
Gotcha. And then who determines the ratio of these educators, the public and private educators versus the older adults? Because you mentioned the minimum is 100 a week. I'm sure we're blowing well past that 100 a week. So who decides what that breakdown is?
Yep, and actually one correction. So we are starting with individuals that are over 75 first. So we are filtering out the list by age and then those that are over 65. So for the educators, it's limited by the number. Is that what you're asking? So we have a list of non-public educators that we've received.
So yeah, we have like Mercy has 30. We gave Mercy 3,500 for older adults, public and private educators. So of that 35, like, are you saying, hey, do the minimum of educators, do 100 a week for educators, and do the rest for seniors? What's that breakdown, and how is that being determined?
Yeah, that's a good question. So again, we are often doing more than 100 for educators, and some of it is looking through the list and how quickly individuals are able to respond. So though we have a list of 4,000 seniors, not all of them will necessarily pick up. Some of them by the time we're able to get to them may have already gotten an appointment elsewhere. So again, we'll have to continue to move through that list. For the educators, again, we did a non-public survey. We sent out to non-public schools, and we go down that list of educators in which we receive those responses from our non-public schools of people who are interested. Noting again that sometimes once we get to folks, they may have already received their vaccine elsewhere.
Right, and so from that list, you're saying that it's sort of a first come, first served basis. So how are we ensuring equity as it pertains to those seniors on that list? Like if we're not simply working from the oldest on down, how do we ensure equity on that? And also another question I have on this: how are we ensuring that folks are actually eligible? So when it comes to the older seniors, you're mentioning 75 or above. That's certainly a great group to start with. A lot of them are retired at that point or no longer working, and so if they don't live in the city, then they probably also don't work in the city. How are we checking that, or are we not checking that?
So 75 and up that live in the city, and it doesn't matter if they're working or not. Again, that is merely an age priority. It's not related to someone's profession or what they're doing. 75 and up that live in the city, and we're able to pull out those individuals. Again, most of the individuals calling through the map line, many of them are city residents, but again, we can sift out who's not a city resident. So 75 and up, city resident, and then 65 and up, city resident.
And is there a way for people to see where they stand on the list?
That I'll have to check with the team and get back to you. That I don't know off the top of my head.
Okay. And by the way, if any other colleagues have any questions, just please interrupt me, or just stare at me, and I'll know to call on you. Okay. So hold on one second. Okay, getting back to the cancellation of appointments. When was the decision made to cancel those appointments?
So we recognized it again the week prior, that we had overbookings and that they were people who likely signed up for a first dose that again, we didn't have appointment slots for. We really needed to preserve appointment slots for our second dose individuals. So we reached out to folks on January 29th via email indicating that they needed to cancel if it was a first dose appointment. We also posted on social media on our website indicating that February was the second dose only clinic.
Right. So, I mean, and in the information you provided, you guys did acknowledge, and I appreciate that you acknowledged that there was an issue with some of those notifications going out, which would explain why of the close to 100 people that I heard from, as well as the 41st Legislative District heard from, not a single one of them had received those notifications. And so now that the City Health Department is a second dose only, and the state has been very clear that they are only allocating doses at this point based on how quickly they're getting into people's arms, are we no longer getting any first doses from the state for the month of February?
No, we are. And to be clear, I think it's not always clear how the state makes decisions around allocations. We're often notified just a few days before. We're only able to request, once for that week. So I don't, it's not 100% clear to me exactly how the states make decisions on allocations. I think the other thing to keep in mind is that as the state is expanding access points, such as again, our mass vaccination sites, our pharmacy partners, we anticipate that doses to local health departments will begin to go down until there's a lot more supply.
So with that being that way, and I understand that they're switching it up, when we get new doses in this week, tomorrow, the next day, whenever they come in, who are you then giving them over to?
So again, our hospital partners, I've indicated that we're providing them to our homeless shelters, our federally qualified health centers. We'll be receiving them as well to support educators, older adults, and homeless residents.
So is this part of the plan that you guys have outlined? Does it indicate who goes next and what the rhyme or reason is for that?
And when you say who goes next, is that still the registration list that we're using or the partners that we're giving to?
And correct me if I'm mistaken, but the registration list that you guys have recently put up is for 65 and above. And so anybody in categories, if there's a doctor in category 1A right now who's under the age of 65, they have no way to communicate with you whatsoever. And so I assume we're no longer working with those folks because they have no way to schedule an appointment in Baltimore City at this point. So a doctor that lives and works in Baltimore City is pretty much, they're sitting duck for now, actually. So when the new doses come in, if 5,000 come in tomorrow, who are you giving those 5,000 to?
So again, many of our healthcare partners, especially our hospitals, are still receiving other doses. They're not just getting our doses from us. They're getting their doses from the hospitals. Our federally qualified health centers are also getting doses, not just from us, but from the state. And there was a recent announcement actually that the federal government is selecting federally qualified health centers to get vaccine directly. Again, our priority as a local health department per MDH's mandate has been to focus on older adults, educators, and homeless. But we know that we have many other healthcare partners that receive allocations directly from the state that can also vaccinate within other portions of the priority group. And so we know that they're providing vaccinations to their staff that may be at risk, but not necessarily in that group that we've been designated to focus on.
Okay, so are you guys going to just be continuing down with those three groups until they are complete and then moving on to other folks that are eligible?
We'll work with the state to understand what their priorities are. And again, I think that some of this is hinging on the limited quantity. So as there's more quantity, I think we'll have more of an ability to expand who we're able to serve. But given the limited quantity, MDH has been pretty clear as to how they're directing health departments to use the allotments that we receive.
Gotcha. And so when we hand over these allocations, what controls do we have in place to know that they're going to the right people. And I'm not going to single out anybody in particular because I'm not insinuating that there is any issue, but certainly people are anxious and stressed about receiving their vaccination. And so what controls, I mean, obviously when it's at BCCC in the control of the health department, we can see who it is, we can see who's coming in the door. When it's handed to these providers, how are we ensuring they're not simply giving them over to other people, especially since we know that, you know, vials can vary between 8 to 11 people, I believe it is, you guys had said. And so what's stopping these providers from taking a vial that, you know, saying it has 8 and giving the other 3 vaccines to, you know, their friends or, you know, somebody who works in the food mart in the hospital in exchange for lunch?
Yeah, so again, we've given them special requirements of who we'd like them to allocate. We provide them with the list. We've asked them to report back to us who they're allocating those doses that we've given them specifically to, what their success rate has been. We've seen where, again, our hospital partners are able to report information back based on, you know, this particular allotment. Again, they can set up pods or doses or days just for X group. So they can just do, you know, an educator's pod. They can just do an older adults pod that is focused on that particular group. And again, we're asking them to report back to us who they're providing vaccine to and what the demographics of that population are.
I mean, I guess my question is not really answered in the sense of like, how are we going, or not even we, how can you oversee and know that there's no abuse? What testing mechanisms are you guys using? And look, I could tell you with a fact that there are people who have been vaccinated by Baltimore City Health Department at Port Covington who are not eligible under 1A, 1B, or 1C. That is a fact. And so with that, we know that nothing is going to be 100%, but certainly we're not at capacity yet at BCCC. We're not close to capacity. And so by giving it to these third parties, I mean, we have to have a more concrete way to control to make sure that there's not going to be any abuse rather than just allowing them to report back and relying on their data. Do you guys get like a listing of the names of who they're giving it to for your internal files?
We have not gotten that listing at this point. Again, we're asking them to report back who they're administering to, but we have not gotten a list of specific names.
Is that a piece of information you're allowed to request from them?
I would have to check and see if that somehow violates HIPAA, but I have to look into it.
Okay, because we've already seen and people have already lost their jobs in the city based on reported abuse of you know, vaccination distribution. And so certainly it's not something out of, you know, the realm of possibility. I see Councilman Conway looking at me. Do you have a question, Councilman? No. Anybody else have a question, or I'll just continue. Okay, I got a few more for you. One of the things that the data you guys provided shows that in a couple of instances, there was waste of vaccines. In one case, there was the waste of vaccines. At the end of the day, there was nobody there left to take it. Certainly, as we spread out and have multiple different locations, what mechanism is going to be put in place to make sure that there is a call list, or there's something that, as some of these appointments are being canceled, which is going to happen, that people on that waiting list can head over to those locations to get it. At BCCC, we've been discouraging people from just showing up, and so even to see that there was 2 vials that went to waste because there was nobody around to vaccinate, I could have guaranteed if you guys put out a message on social media, you probably have 1,000 people who'd respond there within minutes. And so, what can we do moving forward, especially as we get an influx, to ensure that we're certainly getting as many vials into people's arms and that we're going to get to zero waste?
Yeah, no, and there have been so far 3 doses total that have been wasted. So one was from a leaking syringe. So we had a syringe that was leaking, and so unfortunately did not contain the full dose. The other 2 doses, as you mentioned, it was more challenging to find individuals. Generally, we have been able to do that. We've called, in some instances, BPD, or we've been able to call those in phase 1A. That we knew might be eligible, and so it's been minimal. We do have a wastage policy that we received from the Maryland Department of Health, that we make sure that all of our clinics are fully aware and fully versed in what that policy is. So we've done that.
Okay, and is there anybody else who has any questions before we wrap up? No? Okay, so look, I appreciate you coming out, Dr. DeRosa. I appreciate you guys providing all the information and data that you did. We certainly will revisit, and we'll be back here again for oversight, especially as efforts expand. We're going to want similar data to what we've gotten today, certainly around who's getting and what numbers, especially as it pertains to our seniors. I'm assuming those numbers will look very different in a month from now than they do today, considering that the people who've already been vaccinated, most of them have been 1A emergency workers, people in hospitals, police, fire department. So certainly we expect that those numbers will shift. We do appreciate your work. The one thing that I will leave you with is the same thing I've probably beaten over the head, way too many times, over the past week, is that those people who had their appointments canceled on them. I was down there on Tuesday, like I had mentioned to you, and it was devastating. It was really devastating to those people. I walked in there. I mean, I walked through the site. People don't realize I was I've been down to the site 4 times now. People didn't realize I was a councilman. I was kind of kept a low profile when I had walked into the places, and I've uncovered a bunch of issues. Seeing people turned away with no explanation was devastating. I do appreciate that the employees who were down at the site agreed to go down and at least inform people and explain what happened, rather than people just not knowing why they were being turned away. Even an hour after they had sent somebody down, I drove up as if I was there to get an appointment, and one of the Army fellas asked me first dose or second dose. I said first dose. He said this is a second dose only location. And I said, do you have any more information about that? And he said no. And then I called over the lead who was down there to explain to the 3 soldiers who were there, to explain to people why they were being turned away and what was going on. I really think that, as we look through and we know who our priority list is, you mentioned homeless people, educators, and seniors. I would just please ask you, hopefully one last time, to go back into that list of those people who were turned away and people who meet those criteria, especially our seniors, that there be a way that they get a scheduled appointment. And I'm not asking for that to happen tomorrow, but I'm asking that somebody reach out to those folks and let them know, we're not forgetting you. We're not expecting, you to keep searching the web. We have you on a list. We will make sure you get an appointment at some point. Look, we're going to have to vaccinate these people anyways. It's a matter of when we do it. But the stress that it's causing some of these people is really unbearable. I hear from them on a daily basis. I don't know, somehow the same way links have been posted online, my cell phone number has been posted online at this point. Everybody has it. I'm happy to continue to advocate for those who have been turned away and try to find people other appointments. We've done so. Baltimore County has vaccinated a bunch of city residents who were on the seniors list, and we appreciate that. But it's our responsibility to make that right, and we really need to go through that. And anybody who's 75 or above, you're vaccinating anyways, please just get them on a list. That's all I have to say. You can have the last word if there's something you'd like to close out with.
No, just thank you all for this opportunity to talk a little bit about the work that we're doing.
Okay. Thank you very much. The committee is in recess.